Hi everyone. Today I'm here to talk to you all about our benefit plan and the things that you can do as an employee to really make sure that you're doing everything you can to reduce your costs and take care of yourself in the best way possible next year. There are a couple of things that I want to talk to you guys about today that I think can make a really specific difference for you and for the rates that you pay next year and for the programs that you participate in. As a healthcare service provider and being out in one of our facilities, it's really important that we maintain a healthy lifestyle and a healthy way of living so that we can take care of our patients who need us the most. One of the things that you'll see in our benefit plans is that if you participate in the wellness program, you have the opportunity to truly save yourself money in the premiums that you pay next year. So here's my advice to you. If you were in the wellness program this year, please stay in the wellness program next year. Take your healthcare risk assessment, talk to a counselor, do the work that you have to do next year, focus on whatever individual problems you have, but stay in that wellness program. It's so important for you, for your own personal physical health, and it's so important for you, for your own pocketbook in terms of the premiums that you're going to pay. My second piece of advice is for those of you that were not in the wellness program this year. If you weren't in the wellness program this year, why weren't you? You should be. And if you weren't, get into it next year, please. Not only will you find out that it can be meaningful to you in the kinds of services that the wellness program offers and in the people that you talk to, but it's going to save you a significant amount of dollars on your premiums next year. I want to show you a couple of examples from some of our coworkers that have participated in this wellness program and the impact that the wellness program has had on their lives.
I started smoking because I was cool and I looked older than I was, so I was able to purchase cigarettes before I was 18, and it just started that vicious cycle. It's taken a very long time to decide that this is just not the cool thing anymore. It is not something that I want to do. I don't want my clothes smelling like it, my vehicle smelling like it. When I started with the smoking cessation program, I did start online. However, the online program to me was a bit difficult to maneuver. I called in and I asked if I could switch the phone coach, and I was hooked up with Stephanie, who's been wonderful. Support in the form of patches, DVDs, phone calls, internet support, whatever you need, they're willing to be right there behind you. I had no idea how helpful the patches would be until I got them. It's not that I'm not a strong person, it's just that there's no reason to make yourself miserable whenever there are more resources available. There are multiple benefits based upon different reasons. To be able to get the benefit of having the $40 off per month on the health insurance. Secondarily, the biggest benefit would obviously be to quit smoking and then to have the healthier lifestyle, more money in my pocket, the ability to go places with people who don't smoke and not feel jittery and feel like, oh, how do I sneak away from this person so that I can smoke? My greatest success, I would have to say, is my mom is so very proud. Everywhere we go in the family, for the most part, except for my mom, we run into smokers. And so for one of her children to actually take the actual steps to stop smoking is a big thing. And the greatest advice is to believe in yourself. I mean, it's the simple fact that you haven't done this your whole life. No matter if you started when you were 10 or 12 or 16 or 25, it doesn't matter. There were years of your life where you didn't do this, and so therefore, it's not something that is required of you. You don't actually need it as bad as you think you do. You've done this for years and it's a habit, but there are a lot of habits in the world that you convince yourself to break.
I have struggled with my weight for quite a while. I wanted to lose weight. I wanted to do this more than anything else. When Kindred had the open enrollment and the insurance was going to be higher if I didn't go through this, the money had a lot to do with it, and I thought, I'm not going to pay this. And my mind was set to lose it because I wanted to, and I did it. 42 pounds as of today. I've had a lot of wonderful people along the way helping me. About every other month I talk to my health coach. She just helped me in a lot of ways. She's just wonderful. Just someone to talk to. She had already been there. She knew what I was talking about. I usually watch how much I eat, what I'm eating. Exercise has been involved in it. The facility has a respirator, a peddler. They've let me borrow one. I talked to the director about that they were not using. I've got it sitting in my bedroom at home, which I use. Then I do other exercises. I'm out walking. My greatest success is the idea that I've lost this much already, that I've kept it off, and I've got more to go, which my goal is going to be to keep it off when I get it off. I'm not ever going back to this again. I feel better. I've been able to do a little bit more than what I could have done before. Bending my knees for something bothering me, they don't bother me near as bad now as they did. I think the first thing you got to do is you have to make up your mind you're going to do it. Just saying you're going to do it and not doing it's not going to get it done. So I think my head was on that I was going to do this, and I've done it so far. And then, like I said, just watching the foods and the amount and everything. But the main thing was I made up my mind. And once I made up my mind, that was it.
Those are some really exciting stories. You can see real-life employees who have participated in our wellness program and the effect it's had on their lives. I want to thank you for your participation and wish you the best of luck along the way.
Please take the following 5 steps to enroll in Kindred's benefits for 2012. Receive and review eligibility forms and enrollment packets. Understand which numbered group you are in and pay close attention to open enrollment dates and phone numbers. Enroll in the benefits plan that is best for you and your family. Complete an online health risk assessment and submit dependent documentation by December 31st, 2011. Kick off the new year with coverage in Kindred's benefits program. For more information, please visit www.kindredhealthcare.com/employees/benefits.